Hello, welcome to today's presentation, Brain Health as You Age, presented by Dr. Sandeep Walia, neurologist with Washington Health. Dr. Walia is a dedicated neurocritical care physician who brings deep expertise and compassion to the care of critically ill neurological patients. Dr. Walia completed medical training at Georgetown University School of Medicine and went on to pursue a fellowship in critical care at Stanford University. Each day, Dr. Walia provides expert care to patients facing life-threatening neurological conditions, including traumatic brain injuries, hemorrhages, aneurysms, and strokes, making a vital difference at some of the most critical moments of their lives. He currently practices in several inpatient settings, including Washington Health. Please welcome Dr. Walia.
Thanks for the introduction. I really appreciate it. So like she said, I'm Dr. Walia. I'm a neurocritical care physician practicing at Washington Health. So we'll be talking about a little bit different than what I usually take care of. Usually I'm taking care of a lot of patients in their moment of crisis, like seizures, brain bleeds, subarachnoid hemorrhages, or aneurysms. But today we're going to talk about a more preventative approach, and that's essentially keeping your brain healthy, which starts not only when you're a little bit older, when we start to worry about it, but also when you're much younger. And I think it's all a preventative measure that we need to take. I think people have different varying opinions on what's the most important organ, and I think that's based on the specialty you're in. I think nephrologists think that the kidneys are the most important. I think cardiologists think that the heart is the most important, but as a neurologist, I'm going to tell you that the brain is actually the most important. I think the brain is like one of the most powerful organs that you have. I think if all your organs still work, the brain is essentially what makes you you, right? It's what makes you enjoy life, connections with your family, your memories, and your decisions, which are really, really important. So just as we take care of our heart and our joints, I think it's equally as important to take care of our brain as well. So the one thing that I do want to say is that there is essentially normal aging, right? Like obviously everybody is very worried about dementia and whatnot, but there are going to be normal changes in the brain that we're going to have on a day-to-day basis. So just again, like our joints get stiffer as we age, maybe we can't see as close as we normally want to as we age because of nearsightedness. The brain is going to have the same sort of changes. So number one, if you kind of look through these three images, I think all the way on the left here, we have a normal brain right here, and you can tell it's very full and plump. Now what's going to happen as we age, and this is the one picture in the middle, you can see that perhaps it's not as plump as the brain on the left. And what that's called is brain atrophy. So that just means that as we age, parts of our brain are going to get a little bit smaller than other parts of our brain, and that's just normal aging. And with that, we may have a little bit of memory impairment, but it's not going to be terrible, and we're still going to be able to function at a high level. Now, what we really want to prevent with the talk that I'm going to give is something that's all the way on the right here. So you can see that this is much more severely smaller and atrophic than the one in the middle. And if we can control some of our risk factors, we want to avoid getting this, which will increase our risk of stuff like dementia and whatnot. But again, like I said, normal aging does include something that's like in this middle picture, where we do have a shrinkage of the brain. So we do have, as we age, it is normal to have some memory issues. For example, it may take longer to recall a word or learn something new, and also may be harder to multitask or focus on a single task with a lot of things going on. So that leads me to this. Like, I know that everybody is kind of scared as they age, like, oh, I forgot something, but there is normal aging, which, there's some very little that we can do, but we shouldn't really freak out about it. Like if we forget somebody's name and then we suddenly remember it after a while, who we don't normally interact with, perhaps we misplaced our keys, or we occasionally just feel off. And that's a normal part of it, just like I talked about the wear and tear in our joints. A little bit of more concerning features is, if we forget somebody that we're very familiar with. For example, even if we lose our keys, we may not know what to do with them, or if you're in the neighborhood and you forget where you are, these are more concerning features that we really want to try and prevent as we get older. So just like we go in and we get checked out by our doctors, I think the number one thing that we can prevent in terms of brain health is controlling the same things that affect our heart and some of the arteries in our brain, and that's controlling all of our risk factors. So here we have like how our health affects our brain. So just like you take care of your heart by controlling your blood pressure, diabetes, cholesterol, and smoking, the same thing essentially is apparent in our brain. On the left here, we have a schematic of an artery, and this is the artery diameter, right? And so you can see this is not obviously to scale, and the arteries in the brain are very, very small. And they're actually made of muscle. So this surrounding area right here is muscle. So what ends up happening is that, let's say if you have high blood pressure, hypertension, what ends up happening is that you're pumping blood against a very high pressure. It's almost like going to the gym and you are working out and using your biceps. What's going to happen to your biceps muscle? It's going to get thicker. So as you can see here, with high blood pressure over time, the thickness of the wall of your artery actually gets thicker. It's just like lifting weights. And so with that, the diameter and the blood flow that you're getting into your brain actually gets smaller. The same thing happens with here on the right with diabetes and high cholesterol. You can see that the diameter is getting smaller as pieces of sugar and cholesterol are getting stuck on the side of the wall. The diameter gets smaller. And now if you think on top of this, you have high blood pressure, the diameter will get even smaller. Now, as you can see, over time, you may not think very much of this and you kind of think that this is actually like silently affecting the brain. So slowly over time, if you don't take care of some of these things, what's actually going to happen is that we're going to be getting less blood flow to the brain. And less blood flow, and blood carries oxygen. So over time, this narrowing is leading to less oxygen supplied to the brain. And at first, you may not consider this abnormal. You may never even sense this. But over years and years of having something like this, you know, you are going to start to see some of the effects of this, and I'll show you on the next slide. Again, this is a similar slide again. I'm just trying to show you that there are small diameter arteries that are going throughout the brain. And if we narrow them over time, we're going to go ahead and get areas that are not getting enough blood flow, and the brain is going to be affected. Eventually, these can also lead to stroke, which is going to further impair memory even further. And so we do want to really take care of these risk factors. So this is 2 MRIs. So one is on the left of a healthy person and one is on the right of a non-healthy person. So on the left, you can see it's very healthy. We just have a little bit of white matter. So like I was talking about, if you're getting a little bit of low blood flow to the brain because you don't control some of your high blood pressure, high cholesterol, we start to get these white plaques all across the brain. So you can see how significant the white plaques are on the right. If somebody I saw in the hospital, even though they may look fine and I see something on the right that has all these white plaques, I know perhaps they may not be taking care of themselves as they should, and they're going to be at higher risk of dementia. Now, with these white plaques, they're not going to be symptomatic, but over time, over years, over decades, patients may have difficulty with their memory. So first and foremost, the key to most of this talk is that we really need to, for you to take care of your brain, you have to take care of yourself, so taking control of all your modifiable risk factors. But next, I am just going to talk about a couple of what I call pillars to brain health, meaning just stuff that we can do on the day-to-day from when we're a young age to even when we're older that kind of help us kind of mitigate these effects besides getting your daily checks. So number one is just simply, physical activity, and this is not something new and we all kind of know this, but physical activity is one of the strongest tools that we have. Exercise really increases the blood flow to the brain. You can think about it, the heart rate's going to be pumping and we're increasing the blood flow to the brain. And it actually stimulates new cell growth and actually builds resilience like in the brain networks. I don't think you need to like run a marathon or anything, but like brisk walking, dancing, Tai Chi, all of these for 30 minutes or more a day really make a difference in your overall health and especially your brain health. Now, again, some of these things are things that help that not just the brain, but other parts of the body as well. So the other thing is, nourish your brain appropriately. One thing that comes up frequently in our field is the Mediterranean diet. I know everybody has different diets, but generally speaking, you want to stay away from the red meats and concentrate more on chicken and fish, as well as salads as well, and mitigate kind of your excess sugar and processed meats, which is really going to protect your blood vessels as you age. Now, the next thing is also important. Everybody kind of says, hey, always get a good night's rest. So during sleep, your brain usually clears out a lot of the waste in your body, including your brain. So there are little proteins called amyloid that are linked up to dementia. And the more amyloid you have, it's not a direct correlation, but we generally know that the more amyloid we have, the more likely you are to possibly develop dementia. And what it has shown that if you sleep for roughly 7 to 9 hours a day, very often these proteins can be cleared or develop at a slower rate. So typically you should aim for about 7 to 9 hours. And really, if sleep is difficult, try to develop a routine. Keep your room cool, avoid caffeine, and just get into a routine of trying to get as much restorative sleep as possible. The next two are just, kind of keeping yourself happy and mentally engaged. Learning new things is always a good thing, but always keep, just like any other muscle, the more you work it out, the sharper it's going to stay. So stuff like reading puzzles, strategy games are great things that we can do. Whenever we learn something new, we are developing new connections or even reinforcing old ones that can help us stay sharp. And lastly is, social interaction. I think that's understated. Social interaction helps prevent cognitive decline. I think just because it helps keep us happy. We do know patients that, develop depression or loneliness do also struggle with memory. It's called like a pseudo-dementia. And so very often, even chatting with friends over the phone can help your brain stay active and also help your mood stay stable. So again, hopefully I didn't take too much time, but these are the general ways that we can try to keep our brain healthy. First and foremost, and I think is the most important, like I talked about, is you do want to manage all your health conditions and see your doctor regularly to manage your high blood pressure, cholesterol, and diabetes. And, and I think all the stuff that keeping your body moving, getting exercise, prioritizing sleep, and also taking care of yourself, staying social can really go a long way. So that's all I really have for today. And, I just want to impart on you that the brain is also an important organ that, is involved in happiness and longevity and memories. Here's my contact information, but, if you guys we can take time now. If anybody has any questions, I'm happy to answer them.
Thank you. We do have a couple questions. The first question is, can you reverse the plaque buildup in your brain?
That's a great question. So, we can't really reverse it per se, but what we can do is that, keep it stable, right? And so you will see, like, if you recognize you have high blood pressure, high cholesterol, if you let these things go on for too long, we cannot reverse them per se, but we can keep them at a stable position. Even if you have a little bit of plaque buildup or even a moderate amount of plaque buildup, you may not see it affect your cognitive abilities until perhaps it's too late. So even if you see early stages of this, if you control your, all these risk factors, there's a very high chance that you can reverse at least the cognitive parts of it and learn how to adapt with them.
Our next question is, what is the difference between dementia and Alzheimer's, and is there different approaches to treatment?
Got it. Great question. So I would say that dementia is more the umbrella term. So you have dementia up here, and then we have subtypes. So we have Alzheimer's dementia, we have vascular dementia, which is more related to your risk factors. We have behavioral dementia, where you have more behavioral disturbances. And so I would say that Alzheimer's is a part of dementia or a subtype. In terms of treatment, like I said, it's controlling your modifiable risk factors. In terms of Alzheimer's treatment, there are a couple of medications that, providers do prescribe to try to mitigate the risks of dementia. It's an area of a lot of research, because brain health is important. And I think coming through the pipeline over the next year or a couple 6 months, we do have a medication coming out, which, I would contact your provider about. It will take a special pre-authorization, but it is exciting news for our field because for many years we haven't had many treatment options besides preventative health.
Great. And our last question is, what are your thoughts on puzzles, doing them physically or doing them on a phone or tablet? Any benefit one way or the other?
Yeah, that's a good question. I think we are in the new technology era. I think, either one, both are helpful. What you want to do is continue to practice, challenge your mind. I think puzzles on the iPad still challenge your mind. I think if your eyes get tired and whatnot, then obviously switch over to the physical ones. But what you're doing either way, I think, is reinforcing those neuronal pathways, getting your mind to think critically. So as long as your mind is thinking and engaged, I think you're on the right track.
Great. Thank you, Dr. Walia. This was a great presentation, and it does conclude our program. Thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on our Facebook page and YouTube.